So, in the world that we live in today, it has been noticed that there's limited education on the different kinds of sexually transmitted diseases and the major differences between STIs and the most renowned RTIs. Now, today, I'll be talking about the major differences between the RTIs and the STIs. Before I go on, I am by name Oshaibumi Emmanuel. Prospective nurse Oshaibumi Emmanuel, and I'm a student of Kwara State College of Nursing, Ilorin. So, RTIs, they are majorly reproductive tract infections that refers basically to the site where an infection develops. Now, we said reproductive tract infection. It basically talks about the reproductive system and the infections that basically affect the reproductive system. Now, it is basically different from the STIs, which is a sexually transmitted infection, because it is different from the STIs, that is, the sexually transmitted infections, because the sexually transmitted infections talks about the method through which this infection is being transmitted. Now, a sexually transmitted infection can only be transmitted through sexual intercourse or sexual activities with an infected individual. Now, the RTIs come in three forms. The first one I said is the STI, that's the sexually transmitted infection, and examples include HIV/AIDS, human papilloma virus, hepatitis B and C. For the second one, which is the endogenous infections, the endogenous infections are those infections that occur as a result of an overgrowth of a particular organism present in the vagina. An example is the lactobacillus. It leads into a disorder known as the candidiasis or even vaginosis in females. Most cases of endogenous infections have been recorded in females, and they are usually not sexually transmitted. For the third one, that's the iatrogenic infection. The iatrogenic infections are those infections that occur when during a medical procedure or even a surgical procedure where infections on the site of a surgery are being introduced directly into the reproductive tract during either a surgical procedure or medical procedure. The iatrogenic infection occurs in surgical procedures such as induced abortion, IUCD insertion, that is the insertion of intrauterine contraceptive devices, and even during childbirth. Now, cases of iatrogenic infection are shown that it is either during the use of unsterilized instruments or even when the infection being present on the lower reproductive tract are being pushed directly into the vagina through the cervix. So basically, the STIs and the RTIs are just part of the disorders that we have, and they occur majorly through the reproductive tract. The STI is a major type of the RTI, but STI can only be contacted through sexual intercourse or sexual activities with individuals that have been infected. But not all STIs are RTIs, and not all RTIs are STIs. So STIs and RTIs are different. STIs and RTIs are different. A very common method of preventing these two is by what? Number one, indulge in safe sex with uninfected partner. Condomization method is very important as well. And also, go for medical treatment whenever you feel like you're having some certain manifestations, including vaginal discharges or itching on the area of your extremities. So if you watch this video to the very end, I hope you've been able to gain a few knowledge about your reproductive health. It is very important that you take note of everything around you, watch your health, take total cognizance of your reproductive health, and live a good life. This is coming to you from Nursing's View channel. Remember to like, subscribe, and follow us for more. Thank you.